Hello, class. Welcome to Chapter 14, Medical Conditions Involving Glaucoma, the Kidneys, and Thyroid Disorders. So this chapter does not have much on like specific acute medical emergencies, but it does cover some topics that are just important to have some knowledge about so that we continue to be well-rounded, holistic healthcare providers. So chapter 14 begins on page 91. This is where you can also find your key terms, which of course are important to review and understand. Some of these are repeats from previous chapters too, like tachycardia, which is that increased heart rate above 160 beats per minute. But read over those key terms so you have a good understanding of those, and then read chapter 14 and any of your additional reading resources. So we'll just jump right into glaucoma. Glaucoma is not something that you're going to experience again like an acute emergency, but it is a disorder that especially older patients can experience. Now, this can cause an increased pressure in the eye and can eventually lead to blindness, especially if it's not treated. Risk factors are age, family history, and then even a history of cataracts, which is a common surgery that is completed on older patients, is cataract surgery. But the most common type of glaucoma that you will run into with your patients that they're going to report on their medical history is going to be an open angle. Now, they're probably not going to tell you that they have open angle glaucoma. They're just going to say they have glaucoma. But you can ask them, like, oh, do you take medication for that, especially in the form of eye drops, which is usually how glaucoma is treated, is a prescription eye drop. Now, this is a gradual onset, so this isn't a type of disorder that happens quickly. And those eye drops are intended to help slow the process and prevent blindness. The other type of glaucoma is a narrow angle glaucoma. This is a sudden onset and can be acute and requires immediate surgery because it can lead to blindness like right away. But again, this is not something that you are going to experience most likely in like an oral health setting. But nonetheless, it is good to know about it. So some of the treatment implications for just glaucoma in general, especially if somebody is just experiencing glaucoma, is adapting our oral care for limited sight, making sure that our patients can see if we're demonstrating or showing them something, provide safety glasses, which we do to all of our patients anyways. And then another note that your book says is to avoid cholinergics. Now, these are types of medications and agents that we do not use in dentistry. So it's not really something that's super important to know about. The important thing to know is that drugs used in dentistry and the client with open angle glaucoma, there's no contraindications. So we don't have to worry about, certain painkillers that we may recommend, whether they're prescription or over the counter or anything like that. We we don't have to worry about drug interactions in the oral health setting for patients with glaucoma. Now, of course, if a patient does experience an acute attack of glaucoma with the narrow angle, we're going to call 911. So, if patient's having severe pain or something like that, we're going to send them to the emergency room. But again, this is not a common emergency that we need to be, prepared for in the oral healthcare setting. So kidney disorders, again, we're not going to run into like acute emergency type of settings, but it's important to understand these. So the kidneys, of course, filters waste from the blood, and it eliminates waste in the urine. And they manage our water balance. So they're very important. Disorders of the kidney can range from infections to uremia to end stage renal disease. And we will talk a little bit more about that, which is kidney failure. So, some of the oral manifestations of chronic renal failure can be a bad odor from the mouth, metallic taste in the mouth, dry mouth, candidiasis, enlarged parotid gland, mucosal pallor or like a really light color, stomatitis, painful ulcerations, osteolytic lesions in the bone, risk of fracture, hemorrhaging, and gingival bleeding. So, if we add some of those together that maybe a patient has experienced currently that they didn't have problems with before, then we can recommend, that they go see their healthcare provider, especially if they're having more than one of these issues. Could be a sign of an underlying health condition. Right? So, what would we tell a patient? We'll backtrack just a second, a slide. If maybe, say, they had, they report a recent metallic taste in their mouth, their dry mouth, their mucosa is really light colored, and they're having gingival bleeding, which they've not had before. Those are just examples of maybe a combination of things. We're not going to diagnose our patient, but we're going to look for, reasons that this could be happening in the oral cavity. And then we might talk to them about, like, well, when was your last physical? Have you been to your general physician in a while? Did you have these issues going on when you were there? If you did you talk to your doctor about it? If they haven't, then that's whenever we'd encourage them to go back for a follow-up appointment, even if they'd been in recently, and say, these are new. It'd be good to just talk to your doctor about that because I don't see anything oral health wise where these are related that I can take care of. So I'm going to recommend that you go back to your doctor for a follow-up and try to figure out what's going on. So, what are some treatment implications for end-stage renal disease or that kidney failure if you have a patient that is experiencing that and you may be seeing them, right? So, you may schedule an appointment on a day after dialysis. You can consult with their nephrologist about potential complications, review blood test results to evaluate for risk of increased bleeding, monitor clotting, monitor their blood pressure. If they have a shunt where they receive their dialysis, you're going to want to do that on the opposite arm of where their shunt is. You can take panoramic radiographs to check for those bone abnormalities. And then we're going to avoid things like aspirin and NSAIDs for them and set frequent maintenance schedules. So you may see a patient that is experiencing end-stage renal disease because they are going through dialysis currently. Maybe that is the last phase for them, or maybe that is what they're going through prior to like a kidney transplant. So of course, this is one of those times, like in a lot of medical and health scenarios, that we're going to talk with our patient a lot, and they may come with like paperwork that they need for us to fill out that's going back to their nephrologist, or that they have recommended that they come in, and it may have some of the information that we need. And sometimes you'll have patients too that they administer their own dialysis. They've been trained on that, or someone they live with also helps take care of their dialysis for them so that they're not having to go in all the time. But of course, if we have questions and we can't get those answers from our patient, or our patient is unsure of the answers, then we call their doctor. So what about some of the thyroid disorders, right? So we can have thyroid cancer, hypothyroidism, hyperthyroidism, which can result in goiters, and then autoimmune conditions that are thyroid related, such as Graves' disease and Hashimoto thyroiditis. So again, these are things that patients would mention to you that they have, right? Now, if someone has, especially like hypothyroidism, there's a chance that they are probably taking a thyroid medication or hormone. And so you want to ask what, if they take a medication for that, right? If someone tells you that they have a thyroid disorder, you can ask them which one, what is it? And then do you take a medication for that? Um, so, of course, our thyroid is really important. It maintains our body temperature and metabolism, our growth, and it regulates a lot of different body functions. So, that's why if we have hypothyroidism, we take medications to help balance that out. And these are just some examples of some of the thyroid hormones. Um, I'll say these are not super common ones that I've had for patients, but like Armour thyroid is a common one. And so, patients typically know those names. Or if a patient doesn't remember a name of a drug they take, this is for any scenario. A lot of times I will Google just like hypothyroid medications, and usually it'll pull up a list, and I can go through the list and ask a patient. If you say verbally what their medication is, usually they remember that. Especially if they take more than one, it can be hard for them to remember. So, what are some signs of thyroid diseases? You've got the hypo, which is underproducing, and a hyper, which is overproducing. Um, Hypotension is common, or normal blood pressure in hypothyroidism. Also, a bradycardia or a slow pulse, intolerance to cold, um, edema of the face and the tongue, a goiter, fatigue, and dry skin. Now, hyperthyroidism can lead to high blood pressure or hypertension, increased rate of heart rate, the tachycardia, elevated body temperature, heat intolerance, intolerance to epinephrine, bulging eyes, a goiter, nervousness, trembling, and sweating. So you can see how you have much of the opposing, right? Hypo and hyper, as their names signify, you have a lot of the opposite signs for each of them. So, what are some potential thyroid disorder emergencies? Again, this is not common that you're going to have like an emergency scenario, because this means that a patient has been experiencing hypo or hyper for a long period of time. So the likelihood of seeing a patient that is in an emergency state is going to be less for an oral health scenario. So if they have myxedemic coma, this is related to hypo, and they may be really weak or lethargic, confusion and non-responsiveness, super low body temperature, swelling of the body, especially in the face and the tongue and the lower legs, and difficulty breathing. Now, if they have a hyper emergency state, which is the thyroid storm, they're going to have a super rapid heartbeat, high temperature, being sick with diarrhea, jaundice, that like yellowing of the skin, agitation and confusion, and loss of consciousness. So, for either of these scenarios, our emergency management is going to be to call 911 and then do CPR and basic life support if needed. But again, I want to reiterate that this is not a common emergency in the oral health setting, because again, patients will have been experiencing a lot of these symptoms and issues sorry, before they come in. So this is not a common occurrence. But like always, it's important to have some background information just in case. So that is the end for glaucoma, kidneys, and thyroid disorders. So like I said, there's not a lot of like acute emergency scenarios. And the one emergency scenario that has to do with the thyroid is not common. But it is important, of course, to read chapter 14 and take all of those things in, right? So that we have a good grasp of things that we're collecting in our medical history, right? Medical emergencies is important for us to be able to prepare for those acute emergencies. But a lot of it too is that prevention side, and just being able to collect and assess data, asking those follow up questions of our patients, even if they are challenging questions and conversations to have, so that we are caring for our patients and preparing and preventing those medical emergencies. And then, of course, having conversations with other healthcare providers when we need to, and referring patients to whenever there is something new that they're experiencing or we notice something new. Then it's always good to refer a patient and recommend that they see either a specific healthcare provider or just to get in to see their general healthcare provider for further evaluation and assessment, to make sure that there isn't something that's happening for them that has not been caught before. So make sure that you complete any flowcharts, and we are at the end of the semester, so we're going to do that final exam for the last few chapters, and then you have your final project that you will do, which is a big portion of your grade. As always, reach out to me if you need anything, and check those due dates.